Alright, welcome to Environmental Health class. In this module, we're gonna learn some principal definitions in environmental health, such as the definition of environment, health, and then environmental health from the perspective of WHO or World Health Organization, and also National Environmental Health Association. And then we will review some employment opportunities or job prospects in this field. So let's start with some important principle definition in environmental health and define each word one by one. So what do we mean when we say environment? The simplest definition says everything that is outside of your body or external to your body is environment. And the environment can be divided into physical environment, biological environment, social and cultural environment, and any of these environment can have influence on your health status. So what are some examples of physical environment? Temperature, humidity, precipitation, soil, water supply, land, and so forth. So these are outside of your body and can have influence on your body. Biological environment such as animals, plants, germs such as bacteria, virus, fungi. So they are external to your body and they can adversely affect your health. Social and cultural environments such as beliefs, practices, behaviors. You got this with interaction with others, so it is external to your body. So what do you think about the definition of health in environmental health? So health is not just the absence of the disease or absence of the infirmity. The term health in environmental health means a complete physical, mental, and social well-being. For instance, when a person is in a good physical condition but is antisocial, we don't consider him as a healthy person. So definition of the environmental health varies from organization to organization, but the concepts are the same. So let's see the definition of the environmental health based on the WHO or World Health Organization first. According to the WHO, environmental health is all external factors to you, such as physical, chemical, and biological factors that impact behaviors. Okay, so the word behavior is very important here, and in turn can impact our health. And what is the purpose of environmental health in WHO definition is to prevent diseases and to create a health supportive environment. So what do you think? What factors is excluded from environmental health from WHO perspective? Social and cultural behaviors have been excluded from environmental health. The definition of the WHO of the environmental health, and they are considered as a dependent variable. The second definition of environmental health is for National Environmental Health Association. I think the location of association is in Denver, Colorado. The definition of environmental health is to some extent different from WHO. Again, it's about protection against environmental factors that can adversely affect your health, but it divides environmental factors to natural and also built or man-made environment. So what is built environment? The built environment includes physical structures where people live and work, such as homes, offices, schools, farms, factories, or community systems, such as roads, transportation system, land use practices, and waste management. So it's obvious transportation as a built environment can adversely affect our health, like through accident, noises, or air pollution. So how about buildings? In week number 7, I think, we will talk about indoor air quality and sick building syndrome. For example, if you stay in a room for a long time, you will feel sick, nausea, dizziness, because of the lack of natural light or lack of fresh air. So you need to go out and get some fresh air. This is called sick building syndrome, which is very common, especially during winters. Now let's talk about another terminology which is commonly used in environmental health called ecological system or ecosystem. We frequently hear ecosystem in use, but what is the definition of ecosystem? Ecosystem has several characteristics. First of all, it's a dynamic environment, so it's not a static or inactive environment. Second of all, it's a combination of living and non-living environment. So living environments such as plants, animal, microbes, and non-living environments such as air, water, soil. And finally, they interact with each other. So their living environment and non-living environment, they interact with each other in a particular area. So these are the characteristics of a ecosystem. Ecosystem vary enormously in size. The major types of ecosystem are forest, grassland, desert, tundra. As you know, tundra is found in very cold weather like Arctic, freshwater, and marine. An ecosystem is very vulnerable. Although ecosystem is dynamic, they are interconnected components, which means disrupting one of the components can result in the collapse of the entire system, entire ecosystem. And this figure shows that the health of human is associated with the health of ecosystem, as well as that of domestic animals and wildlife. There is another important and well-known concept in environmental health with the name of 3 Ps. The 3 Ps stands for population, poverty, and pollution. And they are the principal determinants of health. So the first P is population, which is growing exponentially in many parts of the world, especially in less developed areas such as China and India. And it is estimated that the population may reach to up to 10 to 12 billion people during the 21st century. The population of the world right now is 7.8 billion. So here we also have carrying capacity. Carrying capacity is the maximum number of individuals that can be supported sustainably by a given environment. So when the population exceeds the carrying capacity, when the population exceeds the maximum number of the individuals that can be supported by environment, so it causes poverty. So how population growth is related to poverty? Because this large population needs jobs, needs food, drinking water for living, right? And because of the lack of food, water, jobs, people or next generation become poorer and poorer. So population growth is associated with poverty. And after that, both poverty and population growth are associated with pollution. Why? Because this large population needs jobs. So governments start to remove forests and trees to build industries, factories. The pollution from combustion of fossil fuels such as petroleum and coal emit greenhouse gases and other pollutants into the environment, into the atmosphere. So, and as you know, greenhouse gases are the #1 reason of the global warming. So an example can be the shift of the geographic distribution of the vector-borne diseases such as West Nile virus that recently emerged in some states in the United States. So we will talk about the effects of the global warming later with more details. So now let's talk about future career for environmental health specialists. So there are numerous careers and occupations for environmental specialists in such as in industry, government units, universities, and private research organizations, and so forth. So they hire environmental health workers in various sections. Let's briefly talk about the most important ones. For example, the first one is industrial hygienist. The job title is self-explanatory. Professional industrial hygienists are responsible for control of hazards that may affect workers in the work environment. How they can help: they anticipate the hazard, they recognize the hazard, evaluate the hazard, and then control the hazard. They are also involved with the design and installation of control systems for hazards in the environment setting. Industrial hygienists work closely with engineers who design and maintain the industrial processes. So what kind of training they require? They require training in the epidemiology, which is the relationship between hazard and health, and biological aspects of environmental hazard, and also in toxicology. Generally, it is science of the poisons, because some hazards can be toxic. So we will talk about epidemiology and toxicology in separate chapters. The next job opportunity is toxicology. Generally speaking, toxicology is the science of the poison, and it has a broad application such as medical, veterinary, forensic, and environmental applications. A toxicologist investigates the effect of toxic chemicals on the environment and living creatures, such as human beings and wildlife. For example, the effect of alcohol, methadone on the human health. Or occupational toxicologists, they investigate the effect of the chemicals found in the workplace on the health of workers. So toxicologists can be employed in academia as professors and researchers in hospitals. For example, the effect of the medications and chemicals on health, and also a variety of private industries and laboratories. Another job opportunity for environmental health experts is working as environmental health inspectors, mainly for government, such as the state or local government. So basically, government determines the standards for pollution, and they are responsible to monitor the quality. They are responsible to monitor and enforce governmental regulations for environmental quality, including inspecting pollution, noise, and water quality. So they go to the field, like by visiting toxic waste dumps, factories, and other sources of pollution, and they collect air, water, and waste sample for testing qualities and standards. So they may be sent out to follow up on complaints from people to identify the sources of pollution and whether it's in compliance with regulation or not, to enforce actions. Another potential career for an environmental health expert is working as food inspectors or food safety specialists. They mainly work to make sure the cleanness and safety of foods and beverages consumed by the public. So where do you think they inspect? Restaurants, dairies, food processing plants, and other food preparation venues. One of the most important foodborne bacteria is E. coli, which is the bacteria found in the environment, food, and intestines of people and animals. It's normally harmless, but can cause nausea, diarrhea, or even can kill people. The other foodborne bacteria is Salmonella, which typically lives in animal and human intestine and shed through feces. Humans become infected most frequently through contaminated water or food of these food poisoning agents. So the scope of responsibility for the food inspectors may also be extended to hospitals, because in hospitals foods are prepared for a large number of people and the patients are very vulnerable. So food inspectors may be responsible for examining the method for handling, processing, and serving of foods to be in compliance with sanitation rules and regulations. And this figure demonstrates a food safety inspector examining the batch of food. Vector control specialists are mainly involved with the controlling vectors such as ticks, mosquitoes, sandflies, or host animals and arthropods that carry disease organisms such as rodents. Vector-borne diseases include mosquito-borne disease such as West Nile virus and malaria, tick-borne disease such as Lyme disease and zoonotic disease, which are the diseases that are common between human and animals, such as leishmaniasis. So vector control specialists may be responsible for educating people about vector-borne diseases, monitoring animal bites. For example, in Lyme disease, it starts with the bite of the ticks called Ixodes scapularis. They can collect specimens for testing, identifying the geographic distribution of vectors. And this figure illustrates a vector control specialist spraying pesticide dust for controlling of vector-borne diseases. Researchers or research analysts are individuals who have experience in environmental health and can work in universities and research centers. In research centers, they can conduct basic research on the risks associated with exposure to certain specific hazards, or they can conduct a statistical analysis to investigate the impact of such exposure on human population. Examples of employment titles found in research settings are laboratory scientists and lab technicians, environmental health, epidemiologists, or environmental health statistician. And finally, environmental lawyer. They provide information to government agencies, assist in formulation of environmental policies, and may be involved in legal actions concerning environmental health problems. An example of a successful environmental policy that is now enforced in many parts of the world is the regulation of smoking in alcohol serving settings. So this policy originated as California's smoke-free bars law, which controls exposure to tobacco smoke and protects bar and restaurant customers.